The South African Medical Association trade union is expected to march in Mpumalanga today to highlight the issues around the unemployment of doctors. In fact, they're expected to hand over a list of demands to government. One of their main concerns is the need to hire these doctors. The union believes this will improve healthcare and create jobs. Watching developments is SABC News reporter Nhlamulo Mabasa, who joins us now live from where this march is expected to begin at any moment now. And Nhlamulo, of course, it's a bit of a counterintuitive set of circumstances. On the one hand, we know how desperately we need doctors in our country. On the other, there are so many of them sitting at home.
Good morning, Ayanda. Good morning to our viewers at home. Yes, like you rightfully said it in your interview, I'll just ask them to keep a bit quiet so that you are able to hear me, Ayanda. I'm trying to move a bit out of shot so that you see before we start talking about what is happening here, so that when they're showing us their plight, showing us what is happening and what their grievances are, Ayanda. But let's actually just talk about why actually they've decided to take to the streets. You know, for some few months, these doctors, they're saying for almost 2 years now, they've actually been trying to communicate with the Department of Health in the province together with the MEC to actually try to find ways to make sure that the doctors that are already serving community service, those that were taken to school by the provincial government, and those that are seeking jobs are employed and absorbed into the system. But it seems like those talks that they are having with the department, or rather with the provincial government, is not bearing any fruits. But to hear more on this and why actually they've decided to take to the streets and their plans going forward, we will welcome Dr. Mandla Tabe, who's the SAM2 provincial spokesperson in the province. Just quickly, we'll let them to please keep quiet so that we are able to interview him and we are able to hear him at home. Good morning and welcome to the agenda, Dr. Tabe.
Good morning and thank you for having us.
Please tell us, why have you decided to take into the streets? I know that for some months this has been your plight. You've been trying to engage the Department of Health together with the provincial government and every other stakeholders that are involved. But why are we here today? Please take us through.
Yes, I think one would have to understand that we have doctors dating as early as 2024 January who have been unemployed, and the plight is not only in Mpumalanga, because previously you would have seen that there are multiple protests that have taken place in the country, with the one in KZN and recently the one in Eastern Cape. I think Mpumalanga is only just waking up and smelling the coffee. We are realizing that there is a problem that we need to resolve, and we have numbers of doctors who are at home ready to serve, willing to serve. They have the stethoscopes ready to go into the hospitals and serve the poor and the needy of our country, but unfortunately government seems not to be coming to the playfield, and enough is enough. This is time. I think what we see behind us bears testament that doctors are tired. Doctors want to be employed so that they can go and serve the communities, and it's not just doctors here. It's the doctors, it's the nurses, it's the community at large saying that we want our right to Section 27 of the Constitution of the Republic. They need to afford us access to basic health care, and they cannot do that if they do not have human resource.
Just how dire is the situation at the hospitals? Because we do get reports that sometimes doctors are unable to cope with the large numbers of community or other people that are coming to the hospitals to be able to come and get services. Also bearing in mind that Mpumalanga province, we are close to Mozambique, we are close to Eswatini. These people also come into this specific province to come and seek services that you offer there. But how dire is the situation?
Yes, one would know that the World Health Organization stipulates that for every doctor we must have at least 1,000 patients. In Mpumalanga, for only the documented residents, we know that we have one doctor is to 3,300 plus patients. And with the number of undocumented immigrants that are in the province because of the proximity to the borders, it means that we are basically dealing with 1 to 5,000, and that is ridiculous. The doctors are tired, doctors are overburdened. It is impossible. Our general OPD departments are always falling into the following day. There are patients, there are our grandmothers who wake up at 2 a.m. in the morning, go to the hospital, and at 4 they are told that you cannot be seen because doctors have seen 200 patients but they are unable to finish the queues. It is dire. The system is failing. telling us the hospitals are dilapidated, there are no doctors, there are no nurses, there are no allied healthcare workers. It is a problem that we must undertake as the employees of government to fight against. Whether you are employed or unemployed, this is a fight for all doctors, and it is a fight for the community, because as doctors sit at home, there are people that are dying in the hospitals.
Let's now talk about the provincial government. Let's talk about the Department of Health, because this is their baby. Even though you do acknowledge that this is a national problem, but when you engage with the Department of Health, rather, what is it that you guys don't seem to be agreeing on? What are they saying? Are they also shifting the blame to national, or what are they saying?
No, I don't think it's a game of shifting blame. We are dealing specifically with Department of Health in Mpumalanga. We acknowledge that it's a national problem, but we need Mpumalanga to account, because doctors have been identified as a scarce skill. How do you fail to invest into a scarce skill? So they must make budgets available for employing doctors and for paying doctors. And we are not limiting it to doctors only. We are saying they must make budget available for the employment of healthcare practitioners to ensure that our people are serviced. And we cannot really accept that there are austerity measures that are being put for health. A country that does not invest in its health is not investing in its future, because each and every day we are having severe cases of simple things that we could have treated if we had enough manpower. So we do not want them to attribute the blame to anyone. We want them to make funds available to employ the doctors. Hence we are saying, if you can read, we are saying employ doctors now. How they do it, that's their own baby to nurse. But the most important thing for us is that doctors are employed and the community is serviced.
And tell me, there were reports that you had latest meeting, I think yesterday or day before yesterday. Apparently there was a certain circular that speaks about cutting of overtimes. And please take us through, please elaborate. What exactly was that meeting all about, and what did you guys reach?
Yes, so the circular number 2 of 2025, released by the HR under the direct instruction of the HOD, Dr. L.K. Nhlamulo, sought to say that all the people who had signed commuted overtime contracts as of the 1st of January 2025, their contracts were terminated. Unilaterally, so they took a decision to terminate those, and also stipulate that they are still going to engage us on how they are going to run commuted overtime in the province. And for those who might not understand, commuted overtime is anything that happens from 4 every day, Monday to Friday, and over the weekends. Doctors are doing that so that we do not have hospitals closing overnight. So if they remove the people who are supposed to do that, it means that you are going to go to Temba at 7 in the evening because you are having a cough, or you've been hurt, or whatever problem, that medical problem that you have, and doctors are not there because they have been reduced the number of hours that they had to do. So our meeting basically was to address that. And as you would have seen, we also took out a bold stand as doctors in Mpumalanga and withdrew with immediate effect our the services from commuted overtime. And I think they woke up, they smelled the coffee, and the following day, when we had that meeting on the 15th, they withdrew that circular on the condition that we both agreed that it was illegal and unethical of them to try and engage in such communication with the members without prior engagement with the doctors. But it must be left said, we are not saying they can come and talk to us, we will allow them to remove commuted overtime. Even when they come, we are still not going to allow them, because this is the bread and butter of the doctors, but it is also the service to the community, unless they want us to close hospitals at 4. If they want that, maybe they should release that circular.
Also, on another matter, there was an issue in certain, especially at Temba, there was an issue of safety of doctors, nurses while they're at work. How are we doing with regards to that? Do you feel now the Department of Health has improved on their safety measures, making sure that you guys are safe while you're at work, or is there still a problem there?
No, I think we will applaud them where they are doing right. Will I say that as a representative of the union that they are at 100%? No, there are still things that are lacking in terms of the security features that were meant to be installed. The only thing that is visible is the beefing up of the security that has been done. But the threat in terms of safety and security is still imminent, and it's still existent. I think, unfortunately, the reality is that we are just waiting to see an an incident happen, and then we will be able to say no, but you had not actually installed everything that we had agreed on. There is movement, we applaud that, and we acknowledge that, but the issue of safety goes beyond an institution like Temba. It goes into the drivers of government vehicles who get hijacked now and then. Every day there's a complaint that someone's car was taken there. We still have a general worker of government who went missing in December 2023 and has not been found even today. So it goes beyond the institution. It's not an event. It's a process. It must continue. We must continue to see changes in terms of how they handle the issue of safety and security in the province.
Last one, Dr. Matabe. You did say that today you're going to hand over the memorandum to the Premier of the province, or rather his office.
Yes.
Why him? Do you think he will be able to, do you think he was not aware of the issues? Do you think he will be able to help in some way?
The view is we've respected hierarchy. We've started at the level of institutions. We've engaged the HOD and top management. We've engaged the MEC. There's only one office left. And obviously this is a staggered approach to the problems that we are facing as Mpumalanga. The 15th of January 2025 was a demonstration that doctors are tired of being mistreated. Doctors are tired of being abused. And we are going to him now to say you are the last office that we can go to in the province. Failure to do so, it means that the province is dysfunctional, then we must shut down Mpumalanga.
Are you saying, should you not get, whether, I don't know whether you're going to give them 7 days or 6 days or a week or a month?
We are giving them 2 weeks.
2 weeks.
Yes.
So after 2 weeks, are you going to take to the streets? What's going to happen?
After 2 weeks, we are coming back to the same office to find the answers if they have not forwarded the answers to us. If they don't respond to that, I think the doctors will be in consensus with me that we shut down the province and we start afresh. It means that they do not take us serious. On the 15th, we showed them that if you mess with us, we can also respond in a manner that is very harsh and inconsiderate. Unfortunately, it is the community that suffers. So when we shut down the province, it is the community that is now going to revolt against government to say, why are you not employing doctors? Why are you not paying doctors? And why are you not employing other healthcare professionals that are very important in the multidisciplinary team?
Thank you so much, Dr. Machabe. Thank you so much. There you have it, Ayanda. There you have it. The doctors are threatening to take to the streets because from here where we are, they will be marching down to the Premier's office, where they will be giving the Premier of the province 2 weeks to respond to their grievances, or rather demands that they want, to be able to get the answers that they want. So there we have it, Ayanda.
All right, Nhlamulo Mabasa, live to us there from Mpumalanga. For now, thanks very much indeed. We'll keep up with you as you keep up with the march throughout the course of the morning.